here at CNN do our best to try to find out what everyone is thinking about issues like health care reform. And so we've undertaken a health care road trip. Ali Velshi is on the CNN Express, and his stop now in Chattanooga, Tennessee. Is that where you are right now?
That's where we are. We've actually just pulled in a little while ago. We've spoken to some people. We parked next to the Tennessee River. It's beautiful. It's a beautiful day here, but people have some real strong opinions about health care. So what we've asked them today, we're trying to get away from the noise of the town hall meetings because so many millions of Americans aren't getting anywhere near those town hall meetings. And we've asked them, what do they want out of health care? What do they want out of health care reform? And there's some themes developing. We're very, very early into this trip. We just left Atlanta today. We're going to be on the road for 5 or 6 days. We're going to end up in Iowa on the weekend. But we're definitely starting to see some themes, and it'll be interesting to see if they carry through the week.
What are people saying? Are they mostly, for instance, are they trying to get to these town hall meetings? Are they attempting to talk to their congressman? People like to bark a lot, but are they actually contacting their congressman?
Yeah, look, there's some, I guess the best way to put it is there seems to be some misinformation out there. People are very, very concerned about issues of choice, not being able to choose their doctor or choose their type of health care. Now, as you know, Catherine, those of us with health insurance are subject to others making choices for us. Not everybody with health insurance can choose what doctor they go to, what procedures they get, what hospitals they go to. But there's definitely an impression that has been left with some people that under a government option, under a publicly funded health care option, some choices will be eliminated. Obviously, cost and quality of health care are the other two major issues on people's minds. But the sense I'm getting initially is that the concerns are a little more basic than the almost sophisticated nature of discussion that's been going on at these town hall meetings, where people have extrapolated what might come of this health care proposal, which is very preliminary and very complicated, and gone all the way to the end and said it's going to restrict choice, it's going to result in not being able to make health care choices, it's going to result in either the government or insurance companies determining whether you will or won't get certain services, and in one extreme, determining when you might actually die because you won't be able to get the services to keep you alive. So I think what we're really trying to do this week is bring the heat down and bring the light up on this discussion and see what average people are really thinking about health care.
You know, when the bailout package was announced, I was out and about talking to people about how they thought, and I was amazed at truly how sophisticated people were on how much they were reading everything they could possibly get their hands on, Ali, to find out more about it. And are you finding that?
It's hard, yeah, and I think that's part of it. It's like where are people getting their information from? Are they reading the documents that are at Congress? Are they reading newspapers? Are they listening to us? Are they listening to talking points? I suppose depending on who you're listening to in the news, where you get your news from, might be influencing things. But I think there's a danger, and I think that many Americans are concerned about this, that this debate might be moving so fully into a political realm that we might not be having a hearty enough conversation about what's actually being proposed and what do people actually want. I just want to check. I think we've got some of the sound of the people that we've had some conversations with. Let's hear it right from them. Let's listen to what people have told us that they're concerned about. Listen to this.
I want to be able to afford the best care that I can for myself and my children.
I want to be able to pick my own doctors.
I like to pick my own doctors and everything else, instead of having to be assigned one.
If we could just take care of that, then I'd be pretty happy.
I want my health care to be affordable at a reasonable cost.
I'm not going to go to the emergency room every time I get a cough or a cold. I'm worried about the big illnesses that can really bankrupt the family.
I don't want to settle for less than the best if our life is at stake.
So you can see, Catherine, those are very elementary concerns. They're, I think, the concerns that we're going to be hearing a lot about. People have very basic concerns about health care. The issue here is I want to get the temperature of how people are feeling about this. You know, we've come off of this financial crisis. People are generally feeling a little better about the economy. Are we getting back into a crisis about how healthcare might be the thing that cripples this economy? We're early in the trip. We're going to be gathering that information, and I hope we'll be talking a lot through the course of the week to get a sense of what's going on. And we're going to be doing that again this evening, talking to more people in Chattanooga about what they are most worried about, bringing that back to CNN and CNN.com, and having that then move back into the discourse. So we're actually getting word unfiltered from average Americans.
All right, well, let's set a date then, Ali, and talk again tomorrow. It'll be interesting to hear what people are saying to you. Where are you headed to after Chattanooga?
We're heading further north into Tennessee, then we're going to cross into Kentucky. So we'll probably go to Franklin, Tennessee, then we'll go to Paducah. But, you know, this is one of those stories where we're going to go where the story takes us. When we run into interesting people who've got something to say, we'll stop. If you see the CNN Express, give us a honk if we're on the road. And if you see us in your town, come and talk to us. We'll go where the story is.
Ali, we appreciate you stopping and talking with us, and good luck on your road trip.
Thanks, Catherine.